Your brain is only about 2% of your body weight, but it needs a constant, strong blood supply every second. When that blood supply gets blocked or a vessel bleeds, brain cells can start dying fast, and that's what makes cerebrovascular disease so serious. In the next 5 minutes, you'll learn what cerebrovascular disease is, the biggest warning signs, what causes it, and how to lower risk starting today. What cerebrovascular disease means. Cerebrovascular disease is an umbrella term for problems involving the blood vessels of the brain and the blood supply to brain tissue. It includes conditions like ischemic stroke blockage, hemorrhagic stroke bleeding, and temporary blockage with stroke-like symptoms. Types: blockage versus bleeding. The main types in simple woe. RDS. An ischemic stroke happens when a clot or plaque blocks a vessel supplying the brain, reducing oxygen and nutrients. A hemorrhagic stroke happens when a blood vessel ruptures and bleeding damages brain tissue. A TIA is often called a warning. Stroke symptoms can go away, but it signals high risk and still needs urgent medical evaluation. Blocked vessel equals ischemic. Burst vessel equals hemorrhagic. Temporary blockage equals TIA. Symptoms: how to recognize it quickly. Stroke symptoms are often sudden, and recognizing them quickly can save brain tissue and reduce disability. Use FAST: face drooping, arm weakness, speech difficulty. Time to call emergency services. Other warning signs can include sudden trouble seeing, sudden trouble walking or loss of balance, and a sudden severe headache with no known cause. If it's sudden and neurological, treat it as an emergency, not a wait and see. Causes and risk factors. Why cerebrovascular events happen. Cerebrovascular events can be caused by narrowed arteries from atherosclerosis, blood clots that form in place thrombosis, or clots that travel from elsewhere embolism. High blood pressure is a major risk factor for stroke and cerebrovascular disease. Other risk factors include smoking and conditions like diabetes and high cholesterol, which increase vascular damage and clot risk over time. Diagnosis and treatment. What happens at the hospital? Because outcomes depend on speed, emergency teams focus on rapid assessment and brain imaging to identify whether it is a blockage or bleeding. Treatment differs by type. Ischemic stroke may be treated with clot-busting medicine within specific time windows, and in selected cases, mechanical thrombectomy to remove a large clot. This is why calling emergency services immediately matters. Self-transport and delays can cost treatment options. Prevention. How to lower risk. Many stroke risks are preventable by controlling blood pressure, not smoking, managing diabetes and cholesterol, staying active, and eating a heart-healthy pattern. Preventing stroke is largely about managing the risk factors that damage blood vessels over time. If someone has had a TIA, follow-up care is critical because it can be a strong warning sign for a future stroke. Protecting your brain is protecting your future, because every healthy choice is a vote for the life you want to keep living. If this video helped you understand cerebrovascular disease, please like, share, follow, and subscribe, because one share could help someone recognize stroke signs in time.